Today, I will be presenting a Pecha Kucha on homelessness and social work practices in urban areas in the United States by Caitlyn Williams from my rural and early class, Social Work 523, Dr. Woods. For my title slide, homelessness and social work practices in urban areas in the United States, will be my topic. I'll be addressing homelessness through a theoretical frameworks and policies. In this presentation, I'll be exploring homelessness in urban areas, discussing causes, impacts, social work practices, policies, and case studies. We'll also look at future trends. Addressing homelessness in urban areas, high rates due to housing shortages and costs, affects health, safety, and the economy, and it is essential for social justice and community improvement. Homelessness is lacking a stable, safe place to live. Statistics and data on homelessness in urban areas. Over 500,000 people are homeless in the United States, with urban areas seeing the higher rates. Major cities like New York and Los Angeles have the largest homeless population. Causes of homelessness. Economic factors include high housing costs, unemployment, and poverty. Social factors, lack of affordable housing, social exclusion, and systematic inequality. And lastly, personal factors, mental health issues, substance abuse, and family breakdown. There are three major impacts of homelessness on individuals is the physical and mental health issues, reduced life expectancy. On communities, it's increased crime rates, strain on public services, and on urban areas, it's economic burdens, decreased quality of life, and visible poverty. Role of the social worker. Provide support, advocacy, and resources to homeless individuals. Theoretical frameworks used. Systems theory addresses complex, interconnected issues. Strength-based approach focuses on individual strengths and resilience. Ecological perspective considers environmental factors affecting homelessness. Systems theory views homelessness as a result of complex interconnected factors. Social workers address issues of multiple levels, individual, family, community, emphasizes coordination among services for holistic solutions. Theoretical framework, ecological perspective. Ecological perspective examines the interaction between individuals and their environment, focuses on how social, economic, and physical environments influence homelessness. Social workers intervene at multiple levels to create supportive environments. Theoretical framework, strength-based approach. Strength-based approach identifies and builds on strengths and resources of individuals, empowers homeless individuals by focusing on their capabilities and resilience, and encourage homeless people to actively participate in developing solutions and achieving goals. Unique challenges in urban settings. Urban challenges. High population density increases competition for resources, limited affordable housing options, greater visibility of homeless leading to stigma and police policy challenges, increased exposure to crime and violence for homeless individuals. There was a case study done on homelessness in New York City. Over 60,000 homeless people nightly. High rent, eviction rates, and lack of affordable housing leads to that. Programs in New York are the New York Housing Authority initiatives and supportive housing programs. Challenges in New York is balancing immediate shelter needs with long-term housing solutions. There are several policies for addressing homelessness. One federal policy is the McKinney-Vento Homeless Assistance Act. Some states have various housing assistance programs. In your local city, it could be a specific initiative and funding for shelters. These policies have mixed results with the ongoing need for comprehensive approaches. Housing First policy provides immediate housing without preconditions, prioritizes permanent stable housing. The benefits of this is it reduces homelessness, improves health outcomes, and is cost effective. But the challenges of this is securing sufficient funds and housing stock for this program. Supporting housing programs combine housing with services like mental health care, substance abuse treatment, and job training. Successful substance supportive housing is pathways to housing. The benefits of this is it reduces homelessness and reliance on emergency services. The challenges are high initial costs and maintaining long-term funding for these programs. Employment and education programs, job training and placement services, educational initiatives for skill development. Some examples of these is workforce development programs, community college partnerships, and the impact of this is it increases employability and stability and reduces homelessness risk. Health and mental health services are essential for addressing homelessness because it addresses chronic illness and mental health issues. Some programs include mobile health clinics, integrated care models. Benefits is that it improves overall health and reduces emergency room visits. And the challenges is ensuring access and continuity of care. Some community-based approaches made by social workers are grassroots organizations and local nonprofits. Examples of these are community kitchens, local shelters, and advocacy groups. The benefits of these organizations is that they're tailored to local needs, increasing community involvement. The challenges are limited resources and a need for volunteers. Collaboration with other sectors. Collaboration involves healthcare, law enforcement, education, and housing sectors. The benefit of these collaborations are comprehensive support and resource sharing. Some examples of these collabs are multidisciplinary teams, coordinated entry systems. Some challenges that these examples face are coordination and communication across sectors. There are some challenges when implementing these solutions. Some challenges faced are insufficient funds and resources, policy barriers and bureaucratic hurdles, community opposition. The only way to avoid these challenges is advocacy, policy reform, and increased funding. Future trends on dealing with homelessness is emphasis on prevention and early intervention, use of technology for data tracking and service delivery, innovative, innovative housing solutions like tiny homes and modular housing, and increased focus on holistic, integrated care models. Summary. Homelessness in urban areas is a complex multi-phase issue. Effective social work practices and policies are very crucial. Continued innovation, collaboration, and investments are needed, and addressing homelessness improves individual lives and community well-being.